Hello, this is going to be the first part of my implant journey, and hopefully I'm gonna make a second part after the operation, a few weeks after. Maybe I can film right in after. Hopefully it's not gonna be too bad. But yeah, I made a little list, so I'm not gonna ramble a lot, and the video is not gonna be all over the place, but possibly it's still going to be all over the place because I like to ramble. So I'm just gonna start with the little chapters that I have prepared. So I found this kind of videos really useful for my anxiety. I have really bad anxiety, so I've been watching a few YouTubers and vloggers that have gone through this procedure, before, after, and all of those things, and it really helped me, and I could relate to their feelings and to what they're going through. So first I'm going to go through my teeth history and why I'm getting it, because I've seen many people do that, and maybe you can relate to my issues. So basically, as a child, I've lived in a very neglectful home. So then I had many cavities and I needed to get many root canals done. And by the time I was 16, 17, 18, I sort of took my own health into my own hands, and I went and I treated different issues that I've had. And this is including teeth. So all the way from 16 to 18, 19 until I left the university. I just went to this dentist, which is my home dentist that I've been to since I was a child, but sort of sparingly. And I've started finally going to him properly and fixing all my teeth issues. And because of the state of some of my teeth, I had to get, I think, 5 root canals. That was a really shitty process, but at least I got it done. I had to get crowns and teeth file. I also had a tooth down here that didn't grow. So I had a baby tooth, but then there was no other tooth. So I have a teeth missing here. And then I had another tooth removed from here, again, when I was in high school on this side. So I'm missing 2 teeth here. And then because of the root canals, I had 2 weak teeth. So those needed to be filed, and I had crown placed on them. So I had a crown here and a crown here, and the teeth underneath didn't live for long. I think I had this crown for about 5 years, maybe this one 5 years too, anywhere between 3 to 5 years, which is not great. But the tooth behind underneath the crown failed. And I was also allergic to one of the materials, which I didn't know when I got one. Whatever, it's a long story, Some people could say it's the dentist's fault. Some people could say it's just what happened or whatnot. The point is that I've taken really good care of my teeth since I've been a teenager and treated all of these things. So I haven't had any cavities, root canals since I was 18, but all of the damage that has been done to my mouth while I was young, while I was getting my adult teeth, those really affected me long term. Now I'm 24 and I'm still sort of having to restructure my mouth and pay for the mistakes that were not necessarily mine, but it is what it is, a thing of the past. If you have gone through similar neglectful, abusive home, and you have mental health issues and other health issues like teeth issues, just know that there is strength in getting past it and doing the things for yourself, and sort of getting a tooth, getting therapy, getting all these things to sort of regain control over your own life and make yourself be healthy if your family did not help you when you were a child. So I think that's very powerful and a useful thing to think about. So I was saying that I had 2 crowns here. I had to remove the crown and remove the tooth here 2 years ago, not right when COVID started, but it was sort of 6 months after, when I could finally go to the doctor. And then I had to get a graft in here because the dentist knew that I want to get implants because I'm young and I'm missing a bunch of teeth. So he put a bone graft there. I could really briefly go through it. I wasn't expecting to get a bone graft. He just told me the day if I wanted. I didn't know what it was, and I just said, okay, I'm gonna get it. And the pain was pretty bad, I'm not gonna lie to you. However, my dentist did not really give me a large amount of pain medication, and I didn't even know I could take more. So I just took a painkiller, which is it's kind of hard to find. It's just available in my country here. But I'm hoping that this time the process is going to be better because I have more knowledge of what's actually being done and what I'm going to do. Yeah, the pain was pretty bad for 5 days. I remember, really bad. I didn't expect it, but also because I didn't know what a bone graft was, so I just assumed it's a normal tooth extraction, and then I didn't know what that was. But now I know better. Anyway, that healed beautifully. It feels great. I didn't have any problems with it afterwards. I had it for as I said, 2 years, the bone graft, and it's fine, and there's a lot of bone there, so it's all good for my future implants. Fast forward to now and to this tooth, which I still have. I have a tooth with a crown on top of it. The tooth has a root canal done on it. I've been having pains with this tooth for a year or even more than a year, probably 2 years actually, because here at the base I only have one tooth and basically so I'm missing one, and then I have one with a crown which is already affected and has a root canal on it. So I just feel like the tooth was basically fighting alone. Like I was eating obviously and all the pressure was going on it, so it decayed. There might have been other issues to it, I don't know. I'm not sure if it could have been saved by doing anything else. My dentist didn't tell me. In September, now it's January, I had a very big infection here. I went to multiple dentists, so in the last 1.5 years, I went to 4 dentists, and nobody told me that my tooth is going to decay and it's gonna die. I kept telling them that I have pain in it. What am I supposed to do? And they were like, there's nothing there. Like, we did the scans, it seems fine, but sometimes it just hurt, so you might just have to take it out. Obviously, I wouldn't want to take it out if it's like, I don't know that it's decaying. But lo and behold, in December, when I went to my checkup before Christmas, the dentist told me that, yeah, it's decayed and you need to take it out, which was not great. And now it's January. What even is it? It's 31st of January, yay. And I'm having my operation tomorrow. So I'm just gonna tell you now. I finished with the history. I'm gonna tell you exactly what I'm getting and the current state. So I have 3 missing teeth, and then tomorrow I need to remove this tooth as well, the one that has a crown on it. And I'm going to get a bone graft because, as I said, in the future I want to get an implant and I want to make sure that the place is prepped and nice. And then apart from that, I'm also getting an implant, which is the name of this video and the purpose of it. I have never gone to an implant procedure before, so I'm very nervous, but I've heard it's less painful than bone graft. Because I haven't gone through this process before, I'm a lot more scared of the implant than the bone graft, even though I know the bone graft hurt really bad. But yeah, because I'm taking this tooth out, I'm gonna have none left on this side, like the ones that you chew on. So then I was thinking that it's like the right time to get an implant, to start getting myself onto this path of getting these implants and finishing basically everything that is to be done with my mouth. So I'm going to get an implant here. In 6 months I'm gonna come and they're gonna put the abutment. So I'm gonna get the rod inside tomorrow, and then the abutment, it's like the thing that I might say it wrong, sorry, is the thing that holds the crown on. So in 6 months I can get that one, and then after the gum is used with it in 3 to 4 weeks I can actually get the crown, which is the actual tooth. So in 7 months I'm supposed to have another tooth there, hopefully if all goes well, and that's going to replace this tooth that I'm taking out now with the crown, so if that makes sense. So another thing that I've written here is mental health. I have generalized anxiety disorder and OCD and also depression, so I have a lot of them. I'm an anxious person to start with, but medical things really scare me the most, and then the most is like operations and bones and dentists. I just hate it. As I said, I had a really bad experience in my childhood with it. So definitely anxiety has been very, very bad. Another thing to consider is that I moved from my home country. So I'm at my home country is Romania, where I'm getting my implant, but I live in England, where I'm a student. I'm a PhD student at the moment, and I've been living there for 6 years. So because I'm not really, I didn't really know what all of these things are, like the implant, the bone graft and everything, I just said I'm gonna come home to my dentist that I had for a long time, that I trust, and also the prices should be better here. But actually I discovered they're not necessarily better, but that's a whole nother story. I just came here staying with my mom. It took a toll on me because I don't like being home, and I had to leave my partner in England and my job and everything. I'm a PhD student. I'm always involved in things at the university. Obviously I can still work from home. I've been working for the last week. But it was a lot of anxiety to take the plane and come here, knowing that I have to stay for 4 weeks here. So it's really taken a mental toll on me. I have sort of like PTSD symptoms from all the things I've lived here, trauma and stuff, that I'm not gonna get into it in this video. But on top of that, I also have dentist trauma and all these like medical operation, anxiety issues, which are perfectly normal. But I have everything on top. I also really like being in my own home, which I'm not in now, and having my my habits and all those things, which again is like, this is not my place. I just feel out of place and I'm not happy about it, but I need to get through it. So basically, because I had issues and infections with this tooth before, my dentist told me you need to come right now. I started talking to my dentist in January, like 20 days ago, when he reopened after the New Year's. And he was like, yeah, if the tooth is bad, you need to come as soon as possible. I was like, oh, I'm going to take a plane in February. He's like, no, it might get worse. You might get a worse infection. It's better to come as soon as possible. So then I just took 2 weeks to arrange my stuff in England, to prepare for my leave, to get all my applications and deadlines done. And I came here, and now it's been 1 week that I've been home. Again, I'm not happy about it. It's not a sort of like home that, you know, it's not a sort of like thing like, oh, I'm happy to be here. Not really, but I have to be here. I'm getting my implant tomorrow, and then because of the bone graft, it's because of the bone graft, I have to stay 14 more days because you don't want a blood clot or something to happen. I'm not really sure exactly what, but definitely consult with your doctor before flying. And I also want to stay for the next 14 days to do like a checkup at 7 days and 14 days to make sure that everything is all right, because obviously my doctor is across the continent and I cannot just fly here if I have an emergency. It doesn't make any sense. So I'm fine with sitting 14 days here. I would be fine with sitting 20 days. I really hate being here, but you know, health is the most important thing. So if my body needs more time, I'm gonna need to give it more time, and I'm fine with it. But I can't wait to get it done and start counting down those 14 days, do my checkup and get him, you know, get it good to go, and then leave, because yeah, I want to leave and I want to go back to my life. So in terms of anxiety, my anxiety has been really, really bad. I had like crippling anxiety, stomach aches, not being able to sleep, trembling throughout the day. It's not completely uncommon. As I said, like I'm very much, like I work a lot and I'm, you know, writing papers, having exams and all things like that, like writing dissertations. So I often have really bad anxiety for that. It's something I try to work on to not be so anxious all the time. But this was even worse because of all the context and the situation. So if you're feeling like that, I can totally relate to you. Hopefully you find this video helpful. I take anxiety pills in general, and I've been starting to take like a plant pill, which I'm going to show you in a moment. But anyway, don't take my pills or recommendations, like medical recommendations, like seriously. Like always ask your doctor. I'm just gonna say what I'm taking, what I think, and do not base any of your decisions on my decisions. That's very important. Okay, good. There we got that. Okay, so now to manage my anxiety and to give you a few tips of how to manage your anxiety now without the pills and the medication that, you know, I'm gonna show you. It's just I wrote here like making a script. So basically I have a script with everything that would happen pre-operation, during the operation. Through my research, I watched many YouTube videos, many operations. That wasn't a great idea, but I have it all. So I have a script with pre-operation, what I need to bring with me, what I need to do, the operation itself, and I'm sort of trying to be like, okay, it's gonna be short. Post-operation, 7 days after the operation, 14 days after the operation, then finally being home in England. So I wrote a list like that to sort of manage my anxiety, and I found it very helpful. I also made a calendar. I'll keep looking at them, but they are put there magnetically. Oh wait, let me just show it to you. So I made a calendar like this, and I'm crossing off the days until the operation, during the recovery period, and until I can go home. And that also really helps me every night when I cross one. I'm like, I feel hopeful that I'm gonna be able to return home. Another thing I did is write in a notebook, why am I getting it? And this is very important to like know your whys, the same as in like losing weight and gaining health journey. Just write, why are you getting it? Why you need to get it now. For me, it was quite a good period because I hate January and February, and this is going to fast track me to that. And also I'm at the beginning of my doctorate degree, and I believe that in my second and third year of my doctorate, I'm gonna be a lot busier. I'm gonna start teaching. So this seemed like a good time to get it, especially because I'm taking one tooth out and this is going to replace it. So sort of like you lose one, you get one. So I was thinking that this is actually a good time to start it. Also having the money for it because it's expensive and I can finally afford it, which I couldn't. Like 1 year ago, I could not think that I would afford this. 2 years ago, we didn't have, like, right at the beginning of COVID, we lost basically all our money and everything. We barely survived. So I would have not thought that I could get this operation because it's very expensive. But things change and you gotta keep being hopeful. If you are in that situation, things can just change. you can also like have a goal and work for it. But yeah, having this notebook with why getting it, why is it good for you, how you're gonna feel better about it, how does it make sense in your overall plan, which my overall plan is, as I said, to improve my health and work on the things that were destroyed, as you know, when I was a child, and sort of improve myself and be that good parent that I didn't have, and help myself through that. So if you have similar feelings, just remember this and sort of try to internalize that this is for you, it's for your health, you're doing the right thing, you're literally reconstructing the bricks for your health. So that's pretty powerful too. I'm not gonna lie, like I say it helped, but I still have like crippling anxiety, so it is what it is. Another thing that I prepared is exercises and things to do during my operation. I don't think I'm gonna be allowed with headphones inside there. I kind of doubt that my doctor will allow me, and also when I put my headphones in, whether they're like wireless or not, they keep falling, so I'm just going to be anxious about him falling. And you know, because when I open my mouth, basically I feel like my ears, like the headphones always fall, so I'm not really sure how people do it. So I'm not going to get that, and also like I want to be able to hear if they ask for anything. But I have prepared a few exercises, starting with like a self-hypnosis thing, which is basically you say, you know, things like outside it's the sky is blue and I'm feeling relaxed, things like that. You know, just try to find something that works for you to think about it. I'm also going to think about my research group from England, and I'm going to try to describe each member of that. So things that you can like sort of think ahead of, that you thought about what you want to do, so you can like easily access those in your mind while you're getting the operation. Also like breathing and trying to relax your body and your hands, maybe bring a ring so you can like play around with it, things like that. Look on the internet and see what ideas you can find. I'm going to put these in practice tomorrow, see if any of them help, because yeah. Okay, let's see. I'm going to go to watching YouTube videos. Watching YouTube videos have been like a double-sworded, what's the expression? Watching YouTube videos has been nice and good. Nice watching videos like this video with people actually going through it, so the patients going through it and expressing their anxieties and concerns, things that I can relate to. So that really helped me, because I felt like I'm not the only one. I also watch other operations and seeing people that go for like, you know, a mommy tummy tuck, and they are like way less anxious than me, or like they go for breast implants and they are like, oh, I'm fine. So that really helped me. But then I watch many operations and many doctors on YouTube, like dentists and, you know, surgery people about implants, and they all recommend so many different things and it's so many different procedures. And then I went and discussed with my doctor, and he doesn't do them that way. So then I was kind of like, why don't you do this, why don't you do that? You can imagine that he doesn't really like being questioned like that. So I just felt like to a certain extent it didn't help me, because I obviously don't understand the entire thing. Even though I'm a scientist and I work with a lot of research papers, I'm not a dentist and I don't research in these things. So it's been really hard to sort of see some things that people get but I can't get, or that my doctor doesn't recommend, or he says, oh, that's bullshit. I cannot judge whether it is or not. Like, it's very difficult. So it kind of made me question my doctor, which is not great. But just so you know, I question everything. You know, that's the kind of person I am. I never believe in anything. There's not a single doctor I went to that I didn't had like an issue with. I'm like, look, but I researched this, I looked at this, because that's just the type of person I am, and I'm fine with it, as long as you know that that's the kind of person they are, and you're happy to get the operation with a doctor. Like, it's the best that you can get in the moment. I spoke with my therapist, and he's like, oh yeah, you saw this doctor in the US where you pay $10,000 to get a thing done, but it's not accessible to me. So do the best that you can with the current knowledge that you have, money, etc., possibilities. So try to keep that in mind. And I definitely think that I'm doing the best that I can with what I have. I like my doctor, that's why I came here to get it done. But again, because of the videos that I watch, I'm like, is he doing it right? But again, like, I know that I'm not an expert in it, so I shouldn't really be so stressed about it, right? Because he's done so many implants, trained people, so it should be fine. I would say that the surgery implants videos, they did help me to sort of see what's going on, which again can be good or bad. It can just make you cringe and hate it, but I like having a view of what's going down. But I watched like 10 videos, and each one of them, the operation was different, and like the tools they used were different, so it's a bit confusing and hard to understand. But I guess that's normal because we are not all dentists, are we? So now I'm gonna take it to my medication. I'm going to take some pain medication, and this is the first one that my doctor recommended. It's called agocalmine. It's actually not a good medication. I looked into the research on this too. Like, it's not really good for your body. You could take other pain medication. Just that my doctor recommended it and my dentist, and I just, it's so complicated to just go against it. Like, say like, oh, there's research done on this, that it's not necessarily good for your body. It's banned in certain countries, but in my country here in Romania, we've been taking this all our life. Again, this is just like besides the point. But this is a strong pain medication that I'm going to take. Then I have paracetamol, which my doctor didn't say I should take, but I asked if I can, and he said yes, because last time I only took the other medication I showed you, which is supposedly a strong painkiller. But he gave me quite a small dosage of it, and I was still in pain. So this time I read what's the maximum amount to take. I read that I can also take paracetamol, and it's fine to combine the two. I also asked my doctor if it's fine to combine the two. He was like, oh, you're not going to need, you're not going to feel any pain. That's one of the issues that I have with my doctor. Is like, I know I felt pain, okay? I'm a sensitive person. I have a low pain tolerance, okay? I'm a little bitch, and I know, you know, I complain about pain all the time. This is who I am. I need medication for it, you know? It's not just like, most people don't feel pain. Well, I'm not most people, am I? And I'm just going to take his recommendations, but also sort of put my own input when I need it, because I cannot be in pain like last time. So I have these two medications. He recommended me that I don't take ibuprofen, even though I've seen most dentists like recommending it after the implant. I don't want to debate that. I'm just gonna listen to him because I don't want to have a problem. Then he say that it's my fault, right? So we're gonna see. Maybe I'm gonna talk about that in the next video to see how I felt with this medication. Then next up, just general medication that I take is my antidepressant and anti-anxiety pill, which I take all the time. I've been taking it for 6 years. You know, just helps maintain like a pace. And then I also have trouble sleeping since I heard that I have to get an operation. So I'm taking this medication for sleep. It's not really important. It's like prescribed by the psychiatrist, so it's quite a hard sleeping medication because I have really bad insomnia. I had it for years, but when my problems get worse, like when I have more anxiety, I literally can't sleep. Again, it's not something I recommend you get. I'm just saying that this is what I'm getting, and this is not unrelated to the implant, right? Like, it's not for the pain, it's just for my anxiety and what my psychiatrist recommended. Then I'm also getting some Xanax for the day of the operation. I've seen other vloggers that done this. I looked at some studies, you know, the day of operation when you're like so stressed and you feel you can't breathe, like I feel right now. It's just nice to have something like that. This is a small dosage of it. But then I also been researching, and I've been researching this for a few months. It's called passion flower, and it's supposedly like natural anxiety relief. You know, makes you calm. It has even been found to help with pain. So I've been taking this for the last few days. I finally got my hands onto it because it was very hard to find, and this is a good concentration of 250 milligrams. I had a family member drink like tea from this, and they can sleep. So I was mostly looking into it for sleeping because I have sleeping problems, and I want to replace my sleeping medication with this. But then the last few days I've taken this at night, and I felt a little bit better, and it didn't necessarily improve my sleep because I was still taking my sleeping pill, like half of it, because it's a pill that you can't really, like, it's not a good pill, okay? I don't recommend my sleeping pill. Like, it can get you hooked, and then you have to spend a few days not being able to sleep, which I'm gonna do after the operation. It's fine, after I'm healed. But I just noticed that every time like the last 2 days when I woke up, I feel like a lot more calm. Even if I didn't sleep well, I was like, oh, maybe I'm feeling better today. So I'm sort of torn between taking this before the operation or this. I have no idea. I doubt my doctor would know what this is, because it's honestly, I don't know if it's a new thing, but I never had anybody talk about passion flower, and I had anxiety for years and nobody recommended it to me. So I don't know, I'm gonna see. Is there anything else? No, I think that's all. I'm just taking my vitamins, which is just normal, and that's pretty much all. 24 minutes, yay. What I'm going to do tomorrow is go with positive thoughts. And I'm telling you this now, but I'm probably gonna be like shitting my pants tomorrow. I'm getting it at 11. It's supposed to take 20 minutes per implant. By the way, I'm getting 2 implants because it's in this bottom area where like most of the grinding and food eating happens. And because I have no other tooth behind, he said it's the best to get it for longevity, you know. And I'm fine now. It's more expensive, but I'm fine as long as it's going to be like a long-term solution. That's what I'm looking forward to. So just do it, doctor. I'm really scared about not being numb enough, but I've read many comments and they said that you are, and I'm gonna make it clear, my doctor did, when I'm gonna raise my hand and say there's a pain, I need another injection. I've heard that people don't feel anything during the actual procedure, just the shots, when they put the numbing shots, those hurt, which I'm used to that too. It is very anxiety evoking. So yeah, the implants are supposed to take 40 minutes, and then the extraction, it's like 30 to 40 more minutes, the extraction and the bone graft together. I think he said it's gonna do the implant first. We're gonna do some x-ray scans to make sure everything is fine, and then do the extraction with more pain injections. And then I'm going to be good to go. I'm probably gonna talk more about exactly what is going to be done after I finish it, because I already know part of it, but I'm just gonna have to go and experience it because it's like long, and already the video is long and everything. Another thing I want to talk is in terms of eating. My doctor was not particular about anything, but I watched many videos. So for the first 3 days, I'm going to eat just like soft, liquid, mostly foods. If I can, if I'm not gonna be like crazy hungry. But last time when I got my bone graft, he didn't tell me anything specific. He just said like eat soft foods, like mashed potatoes. You can't really live just on mashed potatoes even for 3 days. I just feel like it's not nutritional enough. So just 3 things that I got for food. First is protein shakes, which you can drink as long as you don't drink milk, cow milk. Just get like a vegetable milk. So I got like oat and coconut, and I'm going to have a protein shake with chocolate. And that should be good. Just give my body some proteins. I also have puddings, which are again vegan, so I don't have any milk in them, and I got a bunch of those. And then for the main supper, for the main food, my mom is going to help me and make me soup. So she's going to make like veal soup, like sort of like the chicken noodle soup, but it's made on veal, so it's like stronger broth and with vegetables. So it's basically going to be like drinking broth. I'm not going to have noodles for the first few days, and then I might add the noodles to the soup, you know. My cat is crying. So those are the 3 things that I'm going to eat, and hopefully it's going to be fine. I also have planned in the future, you know, to eat mashed potatoes, oats, very soft noodles, soup, and the meat from the soup and the vegetables, but that's after like the first 3 days. Those like very soft boiled like chicken meat and with like soft vegetables. I've seen videos that if you can pinch the food, then you can eat it, so that should be fine. But that's going to be later on after the first 3 days. And yeah, that's what I prepare for eating. I'm also going to take my probiotics. I haven't been given any antibiotics, any antibiotics for the implant, which is something, again, I didn't really understand why, because I've seen that everybody gets it, but my doctor said there's no reason to take an antibiotic if you don't have an infection. You shouldn't take it before. And I've heard this like thought, like way of seeing things through from doctors, especially in England. They are quite against giving medication if you don't have, but I think it's prophylaxis. I'm not sure, but this is like a well-known done thing. Like after the operations, you get an antibiotic even if you don't have an infection, to avoid an infection. I don't know. I'm just going to, you know, go with his recommendations, and I'm just going to call him and tell him if I feel bad and I need an antibiotic, you know. I mean, I'm gonna have to go probably, and he can check it. Luckily he's not that far away, just a cab away. What else? Because my tooth that I'm extracting is quite painful, and I told you I had like an infection in September. He did give me some antibiotics for that. I had to ask for it, but before I came here, I took the flight to Romania. He told me that you need to come 1 week before so you can get antibiotics for the tooth that we're gonna extract. But when I went to him last time, he was like, oh, you don't need it necessarily, you can just extract like that. And I'm like, why did you tell me to come 1 week before? I asked for the antibiotic. I was like, okay, I'm not gonna just extract it like that. Like, just give me the antibiotics and we're gonna see each other in 1 week. So I had amoxicillin for 5 days. Today is my last day. And at least I have that prepping and helping, I guess, my mouth. And that's basically it. It's 30 minutes. As you can see, I'm getting nervous because I know there's not much time left. but it's going to be so much better after I'm done with it. And I need to be proud of myself, and you need to be proud of yourself that you're getting through this. Convince yourself to get this, you know, paying for it. All of these things are like such big things, and it is something to be proud of. And hopefully tomorrow I feel that good that I can take some little snippets of how I am. I'm probably not going to speak for a few days, so I've seen vloggers do it, but I'm not a vlogger, so I might just take a few videos and then hopefully pray to God, pray to anybody that like 5-7 days I'm fine, and maybe I'm gonna be like, oh, let's make the second video because I'm at home and I have nothing to do and I just want to express myself. So hopefully that would happen and you can see the next. And then in the next video I'm going to describe and talk more about the procedure and the prices and maybe aftercare and things like that. So if you're interested, stay tuned for that. And that's basically all. I hope you have a nice day. If you're going through the same thing, I'm there for you. I'm like hoping that everything is going to be well. I'm sending positive energy. Please send some positive energy back because I really need it. And I'm gonna see you on the other side once I'm done. Okay, bye.